Hi dear doctors, welcome to Kids Covery. Today the topic of our discussion is from pediatric nephrology and the topic is going to be renal vein thrombosis. Now it's very rare that a pediatric faculty will teach you renal vein thrombosis because most of the times renal vein thrombosis is something that occurs in adults, but mind you, it also occurs in pediatric age group. That's why it's a vital important topic if you want to become a good pediatrician or you want to treat the patients of pediatrics as an MBBS graduate also. That's why let's understand about the renal vein thrombosis. So now this topic was not previously very important, but nowadays a lot of patients are coming off nephrotic syndrome. Okay, nowadays what is happening, there are a lot of patients who are coming for nephrotic syndrome. Okay, so because a lot of patients are coming for the nephrotic syndrome, we have seen a lot of patients. So nephrotic syndrome has a very important complication, and that complication is nothing but the renal vein thrombosis. So what happens in renal vein thrombosis is that a thrombus is going to get formed in the renal vein, most commonly present with the nephrotic syndrome. I've told you this actually occurs when there is more than 3 grams per day protein loss in the urine. So nephrotic syndrome is actually related to the more than 3 gram per day loss only. Okay, so what happens is that there is a loss of protein C, there is loss of protein S, and they are some factors which normally decreases the thrombus formation. Okay, normally decreases the thrombus formation, but because they are getting lost, if there is decreased, there will be increase in the thrombus formation. Next up, we have hypoalbuminemia also. Again, in nephrotic this happens, and hypercholesterolemia is going to happen. That's again because of the nephrotic. Edema is also going to be the nephrotic case. So there is excessive urinary loss that leads to decrease in antithrombin 3 also. Yes, that's also, antithrombin 3, if it is decreased, of course the thrombus will be formed more. What are the risk factors during infancy? So during infancy, you have got EPLA syndrome. So if the mother, please understand that if the mother is suffering from EPLA, antiphospholipid antibody, then the child is at risk of getting what? Renal vein thrombosis. So whenever there is a thrombus in the renal vein, okay, let me teach you like this. If there is a thrombus in the renal vein, okay, and the renal vein is something that is originally responsible for doing what? For supplying as the GFR to the loop of, to the Bowman's capsule or to the glomerulus actually. Okay, so if there is no blood supply, okay, there will be, see, here is the obstruction. So here will be, a lot of blood is going to start accumulated, and that may produced as hematuria. And because there is very less GFR which is going to the glomerulus, there is going to be oliguria. And of course, there will be flank mass and flank pain that is also going to occur. Why? Because thrombus, there is a lot of blood here, okay, that presents as what? Flank mass. So, in a pediatric patient with gross hematuria and bilateral flank mass, this may signal the bilateral renal vein thrombosis. So, what you have to do? So, patient should be observed for the signs of nephrotic syndrome like anasarca, edema. What is anasarca? Anasarca is actually generalized edema. I'll teach you these things specifically when we'll discuss the nephrotic syndrome. So how will you diagnose? You have to do a CT scan with contrast, okay, in order to check. So CT scan with contrast we perform in order to check if there is any thrombus, renal vein thrombus. And in ultrasound, what does it show? It shows a swollen kidney, okay, echogenic kidney, okay, but it is not very sensitive, so diagnostic is going to be CT. Now how will you treat this? See, of course, the symptomatic treatment has to be given. So first of all, we'll give ACE inhibitors, then angiotensin receptor blocker to reduce the proteinuria associated with the nephrotic syndrome. So ACE inhibitors and angiotensin receptor blocker, they are going to decrease the proteinuria because ultimately they are going to decrease the urine output. So the proteins will also be reduced when it comes to output. Then of course, renal vein thrombosis can develop the pulmonary embolism, etc. So some anticoagulation therapy like warfarin has been recommended for prophylaxis. Surgery is not done, it is rarely done done when there are chances of some complications like renal cell carcinoma, then only we go for doing the surgeries. So this was in a little crisp and concise manner where we discuss about the renal vein thrombosis. I hope the things did make sense to you and you are well versed with this topic right now. Thank you so much.